High blood pressure is such an important clinical condition for us to manage well. It's very common. In fact, 1 in 3 Americans has high blood pressure, and it's estimated that about 5 million Americans develop this condition every single year. Now, it's been pretty well studied, and that there have been many studies looking at high blood pressure and how to best manage it. And yet those studies are based on large populations of people. It isn't really as personalized. And so that results in us trying to manage patients using a bit of a trial and error approach. We'll start with a medication that's designed to kind of work on the heart a little bit. If that doesn't work, sometimes we try a medicine that helps with you not retaining so much fluid. And if that doesn't work, we try another one that tends to kind of relax your blood vessels. Now, this trial and error approach works well for most patients. Unfortunately, there are side effects for all of these medicines. So sometimes patients will get ankle swelling, some people get lightheaded, some people get an unusual cough with it. And so it's good for us to try to find the right medicine up front for most patients. In addition to it being a fairly common condition, it is fairly dangerous in that it is estimated that in 2009 alone, 350,000 Americans died from high blood pressure. And what's even more worrisome, in that decade leading up to 2009, the rate of death from high blood pressure actually went up about 44%. Most of the time, we don't use a personalized approach to controlling high blood pressure. So the study that we've designed with Geneticure is really to see if a person's DNA genetic information really leads to better blood pressure control.
Hypertension or high blood pressure is primarily caused by genetics. This is important because if a disease is caused by genetics, then you can use genetics to help to guide therapy. Evidence for genetics causing high blood pressure or hypertension comes from studies that show that sons of high blood pressure patients are more likely to have high blood pressure compared to sons of patients who don't have high blood pressure. Identical twins are more likely to have high blood pressure if their sibling has high blood pressure. And non-identical twins, it's a little bit lower, but non-identical twins tend to have high blood pressure more than non-twin siblings. There is a upside-down U-shaped or a bell-shaped response rate to high blood pressure therapy or antihypertensive therapy, meaning that most people sit right in the middle where their blood pressure goes down a little bit, but some individuals have a slight increase in blood pressure when they try an antihypertensive therapy. Response rate to therapy is defined when a patient gets their blood pressure below 140 over 90, 140 being the top number and 90 being the bottom number or diastolic blood pressure. Different racial groups respond differently to antihypertensive medications than other different racial groups.
And the way it's designed is a robust process called a randomized controlled trial. So we'll take patients and randomize them into one of 2 groups. One group will be getting their DNA tested, and we'll use that data to treat them. The other group will be randomized to kind of the standard of care, where we will treat patients using the usual protocols that Fairview uses. And then we will follow both groups for about a year and see which group leads to better blood pressure management. We'll also try to see which group has less side effects, as well as which group gets better control overall. Since it's designed as a randomized controlled trial, patients will be followed on a go-forward basis for about a year. So we will see patients on average about once a month or so for a full year, just to make sure we know the impact of the blood pressure medicines is having on them. So there are many benefits for patients participating in this study. They get the results of the genetic testing for free. They will get all of the study visits for free as well. And then we also reimburse each participant about $100 total for their participation in the study. Now, in general, these medicines are well tolerated. Most patients don't have any issues, and yet some patients do develop side effects from medicines. Some of them can cause kidney injury. Some can cause people to have more swelling of the ankles. Some people get a bit of a cough. And so there are some side effects to the medications that we use. So typically, it doesn't cause symptoms when you have high blood pressure, and yet uncontrolled long-term high blood pressure leads to more heart attacks and more strokes, as well as more cardiovascular disease and kidney damage. So it's very important to control this condition over the long term.